Now's the time to finally realize we the people must make some choices. If we want single-payer health care, now's the time to raise our voices.
Okay, well, welcome everybody to another monthly meeting of Physicians for a National Health Program Washington. I'm Dana E. Audio, Vice President of the chapter. I would like to acknowledge that we are on the traditional land of the first people of Seattle, the West Coast Salish people, past and present, and present and honor with gratitude the land itself and their associated tribes. So today, our issue revolves around the ongoing privatization of public goods, specifically traditional Medicare in this case, which is what we're going to talk about. The Trump administration is planning on further cutting of benefits to traditional Medicare beneficiaries. This is known as the WISeR model, which stands for Wasteful and Inappropriate Service Reduction Model. They always have these models with these long titles to confuse everybody. And so what they're planning is to have test cases in certain states, Washington being one of them, by restricting access to defined benefits through the use of prior authorizations, much as is done under Medicare Advantage programs currently. So before we start, David has a few housekeeping issues to discuss, and we'll introduce our speakers who will present the issue at hand.
First, I'll talk very briefly about recent happenings, and then we'll get on with the show. This meeting is being recorded and will be on our PNHP Washington YouTube channel. First, the PNHP Washington website revision is underway, and we'll have drop-down menus with easier navigation, and you'll be able to find both what you're looking for and what might pique your interest. And we have to give a shout out to Simon Hutton from Oregon, who is a master at website revisions and stuff like that. So I'm hoping that we can get this thing going, at least the new website introduced in the next 2 or 3 weeks, and then we'll fill it out over the month or two after that with all the other things that go into the drop-down menus. The Healthcare for Human Rights Coalition is coordinating lots of activities around fighting back against the effects of Trump's big bad bill. It's been very active in the last several months, getting our Health Justice Coalition partners together. I'll put a summary of its last steering committee meeting attached to tonight's meeting report on our website. The steering committee, Healthcare for Human Rights Washington steering committee, will have its third retreat this summer in mid-October. So it's been very active recently, and shout out to Ronnie Schuer, who's here tonight. The steering committee has PNHPWA National, a new national organizer he's stationed in Colorado. It's Ananya Asrat, and he's in charge of, I guess, the western part of the United States. So he's on tonight and get some indication of what at least our chapter's up to, and I met with him privately for it seemed like about an hour last week. Our speakers, we're very fortunate to have two long-standing stalwarts of Puget Sound Advocates for Retirement Action, or PSARA, speaking to us tonight. Robby Stern and Pam Crone about the WISeR boondoggle that HHS is going to try to sneak past us this coming January. Wasteful, Inappropriate Services Reduction Model, which is a very ironic name. So PSARA has more than a 25-year history of organizing for justice and equity in Washington State. It has experienced organizers and resources across the state, and also is respected nationally for its work. So PNHP Washington has worked closely with PSARA for several years. And I think I can say that PSARA is kind of a leading point for organizing for single payer and healthcare justice in our area. You see this, the retiree advocate. So this is one of them. Robby wrote this article August. There's another one in September. This is the one that's current. It's also about WISeR, written by Rachel Madley and Wendell Potter. The retiree advocate has a lot of useful information and comes out monthly. And I highly advocate joining PSARA. You don't have to be retired. Its advocacy affects all generations, and joining only costs $20 a year. I hope after tonight, the first thing you do is just sign up for PSAR. Robby Stern retired from the staff of the Washington State Labor Council in 2008. He has been a key member of PSARA, serving as president for 9 years, and now as president of the PSARA Education Fund. He chairs the Social Security Works Washington Coalition and speaks at meetings of at many progressive organizations. Pam Crone is a lawyer and PSARA's former lobbyist representing clients in Olympia for 20 years. She's basically an institution in herself, full of advice about how to get things done, and knows everyone in Olympia and elsewhere. If you need to contact to get your requests across to legislators and others capable of moving the ball forward.
I think I'll just introduce a little more about PSARA. Actually, PSARA has been around for 45 years, and it's had a couple of different names. The unique piece of our advocacy is that we work to preserve and expand Social Security, Medicare, and Medicaid. But we also have a Climate Justice Committee that's very active, Racial and Gender Equity Committee that's working on a number of issues. There are very much racial justice issues in the whole fight to stop the privatization of Medicare and beat back the challenge of Medicare Advantage to our Medicare system. All of us believe in the necessity of a new and improved Medicare for all, but we sure as hell don't mean privatized Medicare for all. We sure don't mean Medicare for all run by insurance companies, but we're going to have to address the kind of advantages that Medicare Advantage has now, just in terms of how much money they're pulling out of, they're fleecing the Medicare Trust Fund to do what they're doing. But we have also a government relations committee. We have a legislative agenda. We're beginning to put our legislative agenda together. We do advocacy both at the state, local, and federal level. We have a marvelous website that Paul Muldoon is the webmaster for. Paul is there listening to the ball game. Paul has really created a living website that's doing a great job. And David showed you our newsletter. It comes out once a month. We consider it the best non-award-winning newsletter in the country. And lots of interesting articles in it. We are just about to put the October issue to bed. We have a couple of more layout and proofreads on Monday, and then the electronic version of it comes out. And I'm going to give you a little information about at least one of the articles that's going to be in the newsletter. We are very active in trying to stop WISeR. And we are working at both the state and federal level to try and have WISeR deleted, to have it terminated. It's an uphill battle, to say the least, but we're up for it. Pam is going to start us off tonight.
Here we go. And thank you all for being here tonight. And gosh, Central Time Zone, Eastern Time Zone, it's amazing. Really appreciate you being here tonight with us. I think we have some hard things to share and also some exciting things to share in terms of thinking about just what it is that we might be able to do to stop this program. So WISeR, well, if you hadn't heard about it before, you certainly have heard about it tonight. Dana gave a nice introduction, as well as David spoke to it as well. So Dr. Oz, named only in April to lead CMS, was quickly out of the gate in June with a new model from CMMI. And that model is intended, not surprisingly, folks, to make traditional Medicare more like Medicare Advantage. So what exactly is WISeR? WISeR, as you have heard, stands for Wasteful and Inappropriate Service Reduction Model. I don't know about you, but George Orwell comes to my mind. The use of language to control and obscure rather than express clearly what something truly is and what is at stake. WISeR begins January 1st, 2026 in 6 states, one of which is Washington. You can see there the other states. That's going to happen, folks, unless we can stop it. We've heard what WISeR stands for, so now what does it do? As you know, prior authorization is rarely used in traditional Medicare. Contrast that with private Medicare Advantage plans, where the vast majority of enrollees are in plans requiring prior authorization for many services. WISeR would bring prior authorization to traditional Medicare. So rather than patients and physicians, patients and providers making healthcare decisions, the insurer would. So what do we know? What do we know about prior authorization? Well, we know the prior authorization gets it wrong a lot. 80% of prior authorization denials were overturned or partially overturned in 2023. Clearly, prior authorization is flawed. The Office of the Inspector General, charged with truly fighting waste, fraud, and abuse in health and human service programs, found that Medicare Advantage plans break the Medicare coverage rules in their use of prior authorization. And we're also seeing a lot of litigation where the insurer has prioritized profit over care. So here are some stats I know you are probably all aware of. An AMA survey. We know that prior authorization results in delays of care. 93% of physicians have reported that. 82% said the process can lead to treatment abandonment. Just folks giving up, going away, not appealing those prior authorization determinations. 29% reported the process led to an adverse event for the patient. So there's also the administrative burdens. I think that's just an astounding figure, that 39 prior authorizations per physician are made in a week's time. So in a nutshell, doctors' ability to care for their patients is seriously undermined by prior authorization. So here we are. Despite all of the evidence to the contrary, prior authorization, with all of its flaws, is coming to traditional Medicare. It begins with 17 procedures, but we know, and CMS has pretty much told us, that's just the beginning. And we actually have a story that Robby may be sharing tonight. I'm not sure about one of those 17 procedures and what the impact would be on patients in Washington State and throughout the 6 pilot states.
So how does WISeR work? Well, what's going to happen is that CMS is going to contract with for-profit companies that have AI capacity. They are also required to have a physician or a clinician on staff as well. What's going to happen is when the AI denies care, then the clinician is supposed to review it, and that's supposed to be the safety valve. What is really incredible about this program is that these for-profit companies are going to be compensated based on the amount of money that they save the Medicare Trust Fund. It's, as David Lipschutz from the Center for Medicare Advocacy said, it's like a bounty system, that their bread is going to be buttered by denying care, whether it's AI or the clinician that works for that profit that for-profit company. That's how it's going to work. And when I learned today, when they were challenged on that in a meeting with folks from the Center for, what is it, Wendell Potter and Rachel Madley's Institute, the Institute for Healthcare and Democracy, explaining that this totally incentivizes denials because that's how they're going to get their money. The people that they were meeting with from CMMI and CMS said, there's no other way to make it work. That's the only way to make it work. Even though Don Berwick, who was in the meeting and is a former director of CMS, said, well, yes, there is. If you think there are physicians that are actually abusing, then you could identify those physicians and have a requirement of prior authorization for procedures that you think that they are abusing. But CMMI and CMS rejected that suggestion altogether. From data that has been collected, the kind of harm that is being caused by the denials of care in the MA system. And as Pam said, I have a little different number. 87% of the denials that are appealed in the Medicare Advantage system are overturned. But we also know that most people, when they get that initial denial, do not bother to appeal because they're already struggling with something and they just don't do it. So why does the Center for Medicare and Medicaid Innovation want to make traditional Medicare more like Medicare Advantage? Why are they trying to replicate a system that is so broken? Well, next slide, David. They're hanging their hat on what we've heard over and over again, which is, well, we're trying to get rid of waste, fraud, and abuse. The only problem with that is it's bullshit. Because if they were really looking to get rid of waste, fraud, and abuse, they would be looking at what MedPAC says, $84 billion in overcharges by the Medicare Advantage system. And that's a low number according to Physicians for a National Health Program. The study that your national organization did suggested that the overpayments to the Medicare Advantage plans are somewhere in the order of $140 billion. So if they were really interested in dealing with overcharges, waste, fraud, and abuse, they would absolutely target the Medicare Advantage plan because the data is there, they know it, and yet they are deciding to go after 5.8 billion services that they say that MedPAC said has little or no clinical benefit. So what's going on? Well, I mean, we know what's going on. We know that their sympathy is for the insurance companies, for the for-profit world, for businesses that are corporations that have AI capacity. It is thought that it's likely that some of the contracts are actually going to be let out to Medicare Advantage insurers. We haven't seen the list yet, but we understand that they've already identified who they're going to contract with. So at this point, we have come to the conclusion that we have to do everything we can to stop this WISeR model. They are leveling the playing field, but they're leveling the playing field in the wrong direction. They're replicating what we know is it's a failed system for patients and providers, but it works really well for the insurance companies in terms of their profitability. I mean, United Healthcare is now the fourth largest corporation in the country. And a lot of that has been built on the backs of their Medicare Advantage plan. what do we know? We know that resistance is growing to the WISeR program. Today, in our meeting of the National Coalition, we were told that it's really breaking through. Those of us who were in Washington and Seattle know that last week the Seattle Times ran an article that appeared in the New York Times originally that talked about the WISeR program and the potential abuses of the WISeR program. We know that 5 of our 8 Washington Democratic representatives signed on to letters calling for the cancellation of the WISeR program. We are working with our congressional representatives. We are reaching out to all of them. We're going to reach out. In fact, I learned today that one of our members over in Spokane has reached out to Baumgartner over there. So we are going to continue to reach out. Also, very interestingly, what we learned is that the Appropriations Committee in the House has been considering a funding legislation for the upcoming period of time. It's not the same as a continuing resolution, but they are considering the funding resolution. And Representative Finkel from Florida offered an amendment to it that called for the defunding of CMMI's WISeR program. And that amendment to the bill that came out of the House Appropriations Committee passed unanimously in that committee. We know that there is a lot of opposition building. I mean, we just got to believe that representatives from Oklahoma and Texas and Ohio are hearing about this, particularly from Medicare, original Medicare beneficiaries who made that choice and are now having laid on them some of the abusive tactics of the Medicare Advantage program. We also know that approximately 50 members of the House have written letters to CMS saying that they should cancel this program. In fact, we also know that this Friday, CMS is responding by doing a briefing of Washington's congressional representatives or their staff to try and explain what a great idea this WISeR program is. We're also reaching out to Senators Murray and Cantwell to try and get them on board with opposing the WISeR program. We will meet with Senator Murray's staff on September 25th to discuss this. So far, we have had no response from Senator Cantwell's office, which is disappointing, but we're not going to stop trying to get her on board. But there's more that we've done. We know, for example, that both the American Medical Association and the Washington State Medical Association is opposing WISeR. We also have met with the Office of the Insurance Commissioner, and we had a great meeting with them. We sent them a whole packet of material. Pam set that meeting up for us because of her connections in Olympia. And we had a great meeting with them. They were very sympathetic to our position. And in a subsequent meeting where the Commissioner Kuderer was speaking, she was asked about WISeR. She indicated she was opposed to it. And she also indicated that she was going to be talking to other insurance commissioners around the country to try and build momentum through the National Association of Insurance Commissioners to oppose WISeR. We now are aware and are working on Congressional Representative Pocan from Wisconsin and Schakowsky from Illinois have introduced a resolution, a House resolution that calls for the termination of the WISeR program, and they're now seeking support. They have a number of co-sponsors. We are working on getting our House members to co-sponsor that resolution. Today, we learned, as a result of our President Karen Richter contacting Representative Del Bene's office, that Representative Del Bene has signed on to the resolution. And we know that we've had meetings with other representatives. We're told that that there's going to be more that are going to sign on, and we're going to stay on them until they do. We're also when we meet with Senator Murray, we are going to ask her to get out there publicly and talk about this attack on Medicare beneficiaries by CMMI, by CMS, which is what this is. This is an attack on Medicare beneficiaries who are in traditional Medicare, who have chosen traditional Medicare because they want the decisions in their medical care to be made between their medical provider and themselves.
Hey, Robby, can I ask a question? Can you hear me?
Yes, I can hear you.
Yeah, thanks so much. So my name is John. I'm a fourth-year student at the University of Washington School of Medicine. I'm just curious, has your organization, have they looked into which specific committees, whether in the House or the Senate, will have jurisdiction over the WISeR program? I'm just thinking about utilizing your energy and your resources tactfully. I know Senator Murray, she chairs the the Senate Appropriations Committee, which would surely have jurisdiction over this kind of program. So I think energy might be best spent there, whereas others like Cantwell, they don't have as much prestigious appointment.
Well, I actually think the Finance Committee has quite a bit to say about the funding of CMS. But the point here is that you have to have the agreement of the chair of those committees to hear these things. The other thing is when CMMI was created, it was specifically created to deny Congress the ability to cancel programs that they are running. The only control that they have is the one that's reflected in that notion of cutting funding, which they have the ability to do. But we also know that the president doesn't give a darn about what the Congress does. That if he wants to fund something, he's going to make the decision to do it. So, John, I think it's not one where we have to be a laser target. I think we got to build a large presence, a large call across the country for the termination of the WISeR program. So that is what we're doing, and I'm going to talk a little bit more about what we're doing. In addition, we are meeting with, we're giving this presentation to a number of organizations, and I'll just give you an idea of the organizations that we are meeting with. We have met. Oh, we went up to Aljoya, which is a senior living facility, at their invitation to present about this. When we were there, we asked how many of the people that were there had heard of the WISeR program, and 2 people raised their hand. They were PSARA members. The others had never heard of the WISeR program. And I bet you if you talk to friends of yours who are on Medicare, they probably have not heard of it yet either. By the time we were done with our presentation, they decided that they would organize themselves to send a letter to our senators, their representative, the Office of the Insurance Commissioner, the governor, who we want to use his bully pulpit to talk about this attack on Medicare beneficiaries. And then they were going to talk to their state representatives and their state senator, or send it to them. By the time the last conversation I had with them, they said they had 80 residents of Aljoya that had signed on to that letter. So they're getting themselves organized, which is exactly what we hope to do. We've spoken to an organization called Standing for Democracy. We've spoken at a rally at the federal building that's held every Friday to about 150 people. We're having a program at the Burien Senior Center. We spoke with South End Indivisible. And there are many more places where we are doing this presentation. And we are actively seeking other venues to talk, because what we need is a crescendo of people in our state calling their elected representatives and saying, you have to stop this program. You have to make sure it doesn't happen. They have the power to negotiate to demand that it not happen. You have to stop it. So that's what our efforts are. We are asking our representatives to sign on to the Spokane-Shakowski resolution. And any of you who are members of WISeR already have already received email asking you to do it with phone numbers to call, not just once, not just twice, but a number of times. And once they sign on, it's important to thank them for doing that and telling them you want them to talk about this in their public appearances with their constituents to let them know what's going on. So we're just mounting as much of a campaign as we can, but we do not win this campaign in Washington. The National Coalescence, which met today and is made up of a number of large national organizations, has identified as their goal the termination of WISeR as well, and are organizing at the national level in states around the country to put pressure on Congress to hold CMS accountable for their effort to try and undermine traditional Medicare and make it more like Medicare Advantage. So, what can you do? You can call your representative if you haven't yet and tell them you want them to sign on to the Spokane-Shakowski resolution. You can call our 2 U.S. senators and tell them you want them to start speaking out publicly in defense of Medicare beneficiaries in our state and call for the termination of the WISeR program. We will be asking for other actions as we see it as being strategically a viable thing to do. I don't want to suggest to you this is easy. You know, this is going to be tough, but we got to keep trying. We got to keep pushing, and that's what we're going to do. So help us spread the word. Help us find other venues where we can talk about what's going on. And with that, David, I think we can open it up to more questions.
I just had a question. If you could put in the chat the name of that Spokane, whatever thing was.
It does not. It has been introduced. It does not have a number yet, and it doesn't have a title yet. So the way for people to sign on is to call Spokane or Shakowski's office and to say they want to sign on to the Spokane-Shakowski resolution to terminate WISeR.
No, just if you could put the spelling in the chat, because
Which spelling do you want?
I don't know.
There you are.
Spokane,
There it is.
Shakowski, I don't know how to spell any of it.
Okay.
I just put a link in to this is a press release that Congresswoman Shakowski did, and I think that'll give you some information that will be helpful.
I think when we met with the insurance commissioners' representatives, we asked them to contact the insurance commissioners of the other 5 states that are going to be affected by this WISeR program, and they agreed to do that, but I don't know what actually happened after that. Does anybody know?
Well, I do know that Commissioner Cooterer said in a recent public event when asked that she intended to do that and to work within the National Association of Insurance Commissioners to work to build opposition to WISeR.
Great.
She's terrific. She's been great.
Mm-hmm.
I think we've established a really powerful relationship with her. David, you should all know, participated in that meeting, and it was really very positive. And our commissioner has stated that she does not like prior authorization, and so we're really hoping to get some kind of public position statement from her office. So we're working on that, but we're pretty impressed with the progress we've made so far.
Anne, go ahead.
So PNHPWA National is making this their top issue on their lobby day, November 3rd, after the national conference in Washington, D.C., or national meeting. Some of you might have been part of that decision, but just so everybody on the call knows that that's their number one issue for talking to members of Congress on this first ever PNHP lobby day. So if you want to come to DC, I wasn't going to go until that horrible man gets out of the White House, but I'll go for this meeting.
Thanks, Robby, for doing this. I actually enlisted one person new, and they were this shocked. So thank you for doing this tonight. My question, when I first learned about this, I was really shocked that Washington is one of the 6 states. Is that because we have so much tech companies here, or like what is this like a vindictive thing because we're a liberal blue state, or like why is Washington one of the pilot states?
I don't know that we know, Robby, unless you have some intel. I mean, look at the other states. They're not exactly blue states or sanctuary states or, jurisdictions, Ohio and Texas,
Oklahoma,
for
yeah.
example, and Oklahoma. So good question. It would be good to know how they identified those states. Robby, do you know anything more?
No, Andy. I don't know. For some reason, they didn't confer with us when they made the decision. So really, we really have no idea how they decided on those states.
Well, Washington is the only West Coast state that's
Arizona.
on that list. Well, Arizona's not. I wouldn't call it a West Coast state, but
Well,
it
have we
is.
done the? My guess. Have we already done the math? I'm guessing the AI death panels. Have we done the math? Like whatever savings, I'm sure whatever savings we're going to get won't equal the cost we're going to give to these generous tech companies that are going to do this for Medicare, right? I'm sure that'd be one way to beat this, to get the so-called fiscal conservatives on, maybe to say like, what is the cost that this is going to be to Medicare? Because I bet the math isn't there. Has that already been part of the talking points?
Not that we know. It's not part of the talking points, but the reality is, if a provider has ordered up we've had examples of this where one of our members had a growth on his ear, and his provider said he should go to a dermatological oncologist, and it took 8 months to get approval for that, and by then it had gotten far worse. It had metastasized. And so it ended up costing a hell of a lot more as a result of that. The Medicare Advantage plans, and they're not, honestly, they're not designed. When Medicare Advantage was created, they said it was created to provide higher quality service at a lower price. That was the reason that it was created, and it hasn't done either. It's much more expensive, and it doesn't deliver higher quality care. The same thing is true here. They're using the same language. We're going to have high quality care at a lower price by getting rid of this unnecessary services. But we know that these companies are going to be paid more than any savings that's going to come. And I have to say, I think that's deliberate. I think that they are pandering, or not pandering, they're helping out the people that have supported them. I don't have any other explanation for it than that. But Andy, as to why Washington, man, it's a mystery. We have no idea why that is.
But we might have a fighting chance, I hope.
We're going to give it a try. Yep.
I think, Andy, one of the things we know is that Medicare is divided up across the country into payment groups, to Medicare administrative contractors. And so obviously, or apparently, they're dividing it among those contractors. So rather than red state versus blue state, I think they're trying to, and each of these contractors do have different payment schedules, according to the region. And so they're personalized to the region. So I think that explains why Washington State, is in one of these districts and Arizona is in another, that kind of thing.
I wanted to get a couple of other things in that I failed to do, and I want to tell you about this. Today, we received a story from one of our members who many of you or some of you might know because she's a colleague. Her name is Dr. Jaysri Lingappa, and she is retired emeritus professor of global health at the University of Washington. And she retired and she now lives on Fort Townsend. So she recently was suffering from a herniated disc, and it was incredibly painful. And so there was no provider up in Fort Townsend who could do treatment, the epidural steroid injection that was needed. So she tried other stuff. She was in incredible pain. She wasn't able to sleep at night. This was going on for months. So she tried other things so that she wouldn't have to leave to get medical assistance, and nothing was working. So Jaysri searched, and she found that there was a doctor that was about an hour away, I think in Silverdale, who gave those epidural steroid injections. It's something that you have to be trained to do. It takes, she suggested, years of training. They use something called a fluoroscopy in order to get the injection in the right place. And she did it. It made an incredible difference. She, for the first time in months, was without pain. And the thing about the herniated disc, that over time it will heal. And so, but it was not going to be healing as long as she wasn't able to rest and not be able to sleep. So she got the shot, and it made a big difference. And then when they announced the WISeR program, she looked and she discovered that this epidural steroid injection is one of the procedures that has been identified that is now going to require prior authorization. She wrote at the last paragraph of this article that will appear in the newsletter on Monday when it comes out, and which we are sending to all of our representatives and senators. She wrote, "I cannot begin to imagine how much worse it would have made my life to endure weeks or even months of additional excruciating pain and sleep deprivation while awaiting prior authorization, perhaps even an appeal. Is that what our country has come to? Will seniors now be forced to endure pain and illness while knowing that relief used to be easily available if their physician deemed it necessary? Important procedures will soon be out of reach because our government allows corporations to reach huge profits by denying necessary health care." Jaysri has indicated her willingness to talk to our senators, to representatives, to whoever, to tell them what this procedure did for her and how they are now throwing up new obstacles to being able to get that procedure. So that's one story that we have from one of our own members about what this will do. The other thing I want to share with you is a little bit of the resolution that Representatives Pocan and Schakowsky have called on other members to co-sponsor. This is at the end of the whereas as it goes to resolve. The resolution says, "Resolve that the House of Representatives expresses disapproval of the WISeR model. 2, finds that expanding prior authorization processes used in Medicare Advantage into the publicly administered Traditional Medicare program undermines beneficiary access to timely and necessary medical care. And 3, strongly requests that the Centers for Medicare and Medicaid Services terminate the WISeR program, the WISeR model. So that's the resolution that we and other people around the country are asking our representatives to sign on to. And you can help with that. You can help by helping us reach out to more people to tell them about what's going on, by calling your representatives and saying, we want you to sign on to the Pocan-Chakowski resolution against calling for the termination of WISeR. We're going to give it a big shot to try and see if we can throw enough sand into the works. This program fails. Now we can go back to questions. I'm sorry I forgot that, and I want to get to all your questions. We want to get to all your questions.
What is a silver lining in this? What's one thing I can be optimistic or hopeful about in stopping this in Washington State? Is there any like words of hope here?
I think, Andy, that hope is in building resistance. Hope is in building the movement of resistance. You know, I think that's where the hope
Thanks,
is.
brother.
I mean, you know, I think that our job, it's not easy, but our job is to build the resistance to this and all the other abuses that are going on. Because ultimately, you know, we're going to have to do that, and they're going to try and make us feel like it's useless. But we got to build our numbers and our resistance. And this is one thing around which there are a lot of people in our state who don't know this is going on. And if they heard about it, they'd be pissed off. So this is another way to build that resistance. So that's the silver lining, Andy, is building the resistance.
I would just like to ask Robby and Pam, are you aware of any petitions that are going around protesting this whole WISeR model that we can send to our senators specifically, but also our congresspeople? Has anyone created one yet? Or
I don't know of anything. You know, that certainly would be something that, you know, if you would like to take on, you could do that too. I think that we are working on organizing, as, you know, Robby has outlined, and, you know, starting with educating people as to what's happening, where people clearly have a stake and an interest that, as Robby says, are just horrified when they find out. So we have mounted an effort of resistance, and in terms of contacting our legislators and asking House members to sign on to be signers on the resolution, you know, getting the word out to people. Also, so we can make sure that we're sharing those links with you again. And do check out our website. WISeR is an organization of activism. So we're doing a lot of things. We have not initiated a petition yet. I'm not aware of others that have done that, but maybe that's something that somebody else will be doing.
Pam, it's my impression also that it is more effective to have individuals calling in to the offices than it is to send a petition with signatures. Now, Dana, if you're thinking of the petition as being supplementary to the power of contacting our representatives, I agree with Pam. I think it'd be great if you were to initiate that, if that were to be something that came out of this meeting that PNHP Washington wanted to do. But I think there is no substitute for that. Individuals, lots of individuals, calling those offices and raising the banner of the necessity for these representatives, not only to sign, but when they go to town halls, when they talk, WISeR needs to be part of what they're talking about to the audiences that they're with. That's what we need, people who are in those positions to use their bully pulpit to talk about this attack on Washington's Medicare beneficiaries and to Medicare beneficiaries across the country. Because believe me, their plan is not just to confine this to those 17 conditions or procedures, nor is there intent to leave it within 6 states. They now have the 6-year pilot program. We were able to get rid of the GEO model. Remember that, the GEO model? Well, it's coming back, Damon. It's coming back, and so we're going to have to fight that one again as well. So they're as relentless. We got to be as relentless as they are.
Okay, I agree with that approach, Robbie. Thanks so much. So let's see, we lost one of the questions. Tony, did you want to ask your question?
Yes, please. I was wondering if you know what the procedures are that are going to require the prior authorization, if that has been decided, if it's been publicized, or if they haven't decided yet.
No, they have decided. That's how we know
Right.
that epidural
Yes.
injection is one of them. There are 17 procedures, and if you go to the CMS website and you look up you look up a WISeR, you'll be able to find the 17.
Okay.
Yeah, they're there.
Thank you.
Yeah.
I just wanted to know if Pramila Jayapal has already signed on to the resolution or not.
Pam, you talked to their office. What did they say?
I talked to their office today, and I haven't heard back confirming whether she had or not. We did not see her name listed, but we certainly think, and the office did confirm, that this would be definitely something that Congresswoman Jayapal would be interested in signing. But we don't know that she has yet. She was one of the signers in our delegation on the letter that Robby referenced earlier. There were 2 letters from House members, one spearheaded by Representative Congresswoman Del Bene, another one by AOC and Lloyd Doggett, and that was the letter that Congresswoman Jayapal signed. So I'll be following up with her to make sure that she was able to do that.
And by the way, the representatives that signed on to those letters from Washington were Representative Jayapal, Representative Smith on the AOC Doggett letter, and then on the Representative Del Bene letter was Representative Strickland, Representative Randall, as well as Representative Del Bene. So they all have signed on. Who didn't sign on from the Democratic side of things and have not yet stated a position are Representative Schreier, which I would think would be on this, but Representative Schreier, Representative Larson, and Representative Glusenkamp Perez. But we also are going to reach out to Representative Newhouse, and we've already reached out to the Representative, I forget his name now, but Spokane. We are making it clear that if you signed on to the letters, we want you to sign on to this resolution as well. We want to get as many signatures on this resolution as possible.
Yeah, the Washington State Medical Association is having a meeting. I think, I don't know if it's an annual meeting or what they call it, this weekend, I think. And they look at resolutions that are proposed and then voted upon and passed or not passed. I looked at last year's, I'm not a member of a medical association, but I looked at last year's resolutions, and one of them was about prior authorization. So I got a hold of Physicians for Social Responsibility that was on that prior resolution. And, I think they're aware of this WISeR thing and are going to bring it up at that meeting, but I'm not for sure.
I read a statement, David, from WISMA that they're very concerned about it. I mean, the parent organization, AMA, came out against it. So there was a statement that I read, and we're in touch with the representative of WISMA from Olympia, and she was wanting to sit down and talk with us when she returned from a trip that she's on.
Well, I think it's going to be an issue there the next 2 or 3 days.
Well, I hope some of you are there to see that they take the right stand.
I was just a little confused about who to call. I think I've already called Cantwell and Murray. Is there value in calling again? Or who else should I be calling?
Yes to both. Cantwell, Murray. Have you called? Is Adam Smith your representative?
No, Jayapal.
Jayapal. Call Pramila's office. and ask her to sign on to the resolution.
Yeah.
And once we learn that she has signed on, we'll let it be known, like we're letting it be known. Representative Del Bene has signed on. We should thank her. Then the next step is to ask her to start talking about it in town halls and other public events that she's in.
And if you have any contacts, in Representative Newhouse's district in Yakima or Baumgardner in Spokane, that would be great. Contact them too. They have Medicare beneficiaries in their districts. We are reaching out also to Marie Glusenkamp Perez's district, but anybody who has contacts there, probably contacting your own representative, looking for contacts in these other districts and both senators. And it's okay to call more than once.
Well, the last communication we had from Senator Murray was that the office is tracking and monitoring it, and we said no. That's not going to go. We need more than tracking and monitoring. So, Mindy, I would encourage you to also call Senator Murray, and we haven't heard a peep from Senator Cantwell. So I would encourage you to call them again and wait a week and say, I haven't heard anything from you. Please, I'm going to keep calling until you show me that you're standing up for Medicare beneficiaries in Washington by opposing WISeR. So feel free, schedule it in at least once a week for the senators, and regarding Representative Jayapal, once she signs, and I'm confident she will, then just a thank you that she did will be great. Now, we're going to have a campaign with the governor. We want the governor to start talking about protecting Medicare beneficiaries in Washington too. We're trying to figure out the best way to get in. We did ask the insurance commissioner to please give the governor a call. I don't know if she's willing to do that or if that's going to happen. I do know that Adam Smith's staff was going to call the staff of the governor and say, hey, we got this thing going on. We're going to need the governor's help. So, but we're not ready to mount that campaign yet. We got to make our first run at the governor and see what kind of response we get, and then we'll decide whether to do that. But we want the governor to speak out on it like he's speaking out on other attacks of residents of Washington. This is an attack on Medicare beneficiaries, and it's time to come to our defense.
Yeah, I'm sorry. Thank you for taking my question. Representative Del Bene, I'm sorry, I was just wasn't quite clear. What has she done? She sent a letter, or is she the only one that sent the letter? Where did she send the letter? Or?
No, both questions. Here's the answer to that. The Representative Del Bene authored a letter that was signed onto by a number of other representatives, including Representative Strickland and Representative Randall from Washington. That letter was sent to Dr. Oz.
What did the letter say?
The letter said cancel the WISeR program. Okay. That prior authorizations have shown through the Medicare Advantage plan to be abusive. Do not spread them like a malignancy to traditional Medicare. She didn't use that language. That's my language. She never said that.
Okay, so when I call her, I should thank her for sending this letter.
And thank her for signing on to the resolution.
Okay, thank you for signing on the resolution.
The Pocan-Chakowski resolution opposing.
Ask her to speak about this with her constituents.
Right. That's exactly right. You got it exactly, Howard.
So those three things.
You use her bully pulpit to help educate people that don't know if this is going on, because that's the way we're going to defend Medicare beneficiaries in Washington.
Okay, thank you very much.
Thank you.
Everybody on this call knows that the business tactic of requiring prior authorizations and use in Advantage plans spreading to traditional Medicare is not administratively costly, useless, and can harm patients actually. But I'm wondering if it would be helpful when we talk to members of Congress, and if they would even understand this, to say that if you really care, and there's a corollary that's being studied here in Minnesota, the concept of low value care. Have you all heard about? You've got familiar with that phrase? There's this obsession with the idea that doctors are ordering unnecessary care and somehow profiting from this, and that it's the business of the insurance industry and now government to crack down on that, right? So maybe we offer an alternative and say, if you really think this is happening, then your job is to audit, find pockets of perceived overuse. You can audit and you can develop criteria for treating conditions, but blanket requiring prior authorizations for 17 conditions that you somehow think are unnecessary is really wasteful.
There was someone today in our discussion, the national discussion, that said they're taking a sledgehammer
Right.
to something that needs a precise knife.
Exactly. And they're just refusing to do the hard work of identifying, are there pockets of, and really what they're going to do is they're going to waste a lot of money. Somebody's going to profit. People will be harmed. And I don't know how we get this across to our electeds, but we've got to try, I think.
Well, you all have a lot of credibility. So, you all got the second wind on these questions. That's cool.
This makes me fired up. I mean, I'm not a physician, I'm a nurse, but I can figure this out. Right.
Oh, yeah. Thank you, Ann. Ronnie.
So I think that, we've talked tonight about the going to legislators, but I think we really should capitalize on the work that PSARA has done with our insurance commissioner. Getting a prior authorization, there are guardrails with insurance companies as well, but especially with Medicare. So getting personal stories like you shared, Robby, and sharing that with Patty Kuderer are a valuable pathway to fight this on that level. So I think we need to be going from both directions. The political action we should certainly maintain, but we've called out for patient stories about things in the past, and we've had some wonderful response. To be a hero program brought out a lot of people. David McClanahan's videos of people at different meetings really helped raise that. Public comment that's directed at specific denials can be really useful. And Patty Kuderer has made it clear to us that she will take up that fight if we can get those cases to it. We need to pull them in. We need to pay attention to that. So often prior authorizations are used because people just give up. People don't know how to do it. So by collecting stories, we can create a pathway through Patty Kuderer's office to oppose this on that level. And this is a scary thing. Like we were talking about 17 clinical treatments, but that can double and triple and quadruple and can go from one area of the country to another. We have a powerful role, being chosen by Medicare, our particular state being chosen might actually be a silver lining. Let's really focus on that. So, Robby, thanks for pulling in that one story. Let's broadcast this as we talk about telling people to write to their senators and Congress people. Let's tell them to give us the story and let's take it to a real ally that we have in Olympia, who is Patty Kuderer. So thanks for your work to doing that. I think there is a pathway, to fight this, or that's one of the pathways we should use.
No question.
I think you're right, Yeah,
Go
I
ahead.
was just going
Go
to say,
ahead.
Ronnie, I mean, for sure, in Washington State, I think we do have a duty to amplify this story. And, we've got the chops to do it. And, we're organizing to do that. And funny you said that. We got that story off to Patty Cooter's office today and couldn't agree with you more about the importance of stories. So that's also something that people can do. The program hasn't been implemented yet, but we certainly have stories of prior authorization in privatized Medicare, which is what we're trying to avoid here. So thank you.
I mean, the other thing is that people who had treatments that are on the prior authorization list also have stories to say about what it would have been like if they had not gotten the prior authorization. So, it's both, Ronnie. You're right. People who have dealt with prior authorization, and also people who had treatments that are on the list that have been helpful to them, like it was true with Jaysri. And I think that's very powerful. And the legislators love it. They love the stories.
Okay, one more question, Andy.
Hey, one other metric I think would be good to look at. I remember Kip Sullivan, I think it was 2 years ago, he had the math on back when it was just Medicare Advantage eating into the funds. And I thought he had projected that by like 2027 or something, or 2028, like the funds were going to be gone or something. It was like some crazy thing. And so obviously with AI companies now eating into the fund, it'd be really good to know, and maybe this is a Kip Sullivan question, but I was just curious if like what that acceleration will be if the Medicare funds are going to be, obviously I'm sure it's going to be Medicare funds that are going to pay the AI companies to be doing this, but I imagine they're going to accelerate that timeline of when the fund is truly depleted. Do we know anything about that?
We don't. We don't
It's
at
a
this point.
Congressional Budget Office question, isn't it?
Well, I don't know that the CBO has been able to look at this and estimate the numbers that are going to be involved in these 17 procedures. We have not seen anything yet, and there's some people who are pretty studied on this. I mean, like Rachel Madley, and they have not raised any. They're going to be looking at that. Wendell Potter, they're going to be looking at that, but so far that has not come out yet. But Andy, that's a good point, and right now our job is to make sure that it tries to go. We try to get rid of it. That's right now our job, and that's what we're going to work on.
Cool, yeah, because I think the one way that we could maybe build in some political alliance from politicians is the fiscal conservative argument. So I'll leave you with that. I'll try to find out the answer. I'll send it through PNHP. If we can, I bet Kip Sullivan might know how much this is eats in.
Add this to the cost of the fraudulent overpayments to Advantage plans. The 90 to 140 billion. Add the
And remember Pissarra's answer to that, which is scrap the cap.
well, that's Social Security.
And it'll have a direct effect.
That's Social Security. We're talking Medicare fraudulent overpayments to Medicare, that are draining the Medicare trust fund.
All right, David, any final words?
No, just this was a very, very good meeting, and thanks to Robby and Pam for lending their expertise and giving us more knowledge of what's been happening and things to do. We all got our list, and I'll get it out on our YouTube when I get it up in our meeting report, which hopefully I'll blast out on Friday and get on YouTube on Saturday or Friday.
Well, thank you for this opportunity, David. And I do want to encourage people who are not yet members of PSARA. It's only $20 a year. You can join on the website. You can get this outstanding newsletter, and we'll pretty much keep you up to date on what's going on. That, along with our website, are up to date, and $20 a year. And I hope you'll consider it to be worth every penny.
And I can say that I read that newsletter cover to cover, because every page is interesting.
All right.
Before everybody heads out, can I say a couple things real quick? One, I wanted to just invite everybody to the moral injury webinar that's going to be coming up on October 7. I believe it's going to be 5 o'clock at Pacific. It's going to be a lot of the research that's going to be compiled from the surveys that was sent out, and what are some action steps that can happen. I also wanted to just, you all did an exceptional job of talking about the annual meeting with PNHP in November. If you are able to go or you're thinking about it, I would highly encourage you to go so we can put people with their elected officials and really demystify politics, but also really push our elected officials in masses. And I think people power is one of the avenues that we have.
Mhm.
And would it be okay if I checked in, I think, with David and see if I can send him my Calendly and we can find a time to meet one-on-one within the next few weeks or few months, just so I can get to know who you are, what you're working on, and I can be able to be as good an organizer for this group. And you guys deserve an exceptional organizer. So,
Who did you want to meet with one-on-one?
just everybody in general, just to have, just to get to know people, what you're working on, what you want to see happen. I could drop my Calendly link in the chat, and feel free to check in with me whenever you guys need me to. Ideally, just initially set up a one-on-one conversation with me, but then as we're going to be organizing and building the people power, I want to be a tool that you guys could be able to rely on. Thank you for the time to speak.
Great.
Chose an interesting date for the moral injury seminar, October 7th. Could you put that link in the chat?
I'll include it in my blast that goes out and put it on our website.
Okay, you have it, David?
I'll get it. I think I've seen it in the email today, but I'll definitely get it one way or the other.
Thank you.
I also just dropped it in the chat, but thank you very much, David. Really appreciate the work that you're doing.
All right. You can sign us off, David, or?
Okay, at the count of 0, I will end the meeting. So 5.
Bye, everybody. Thank you so much for coming.
2, 1, 0.